all schools in the United Kingdom are supposed to reopen on the 8th of March as part of Prime Minister Boris Johnson's cautious four-part plan to lift the coronavirus lockdown. Now, we know that the UK has had a lot of casualties, a lot of deaths, a lot of people who are still fighting the COVID-19 pandemic as we speak. We also know that a new strain, a new variant of COVID-19 also emerged in the United Kingdom, and that made a lot of people there were a lot of apprehensions in the United Kingdom as far as what is going to happen in their country as far as their future is concerned. Their economy was hit badly as well. Now that this decision might come at the end of the day, as Boris Johnson is going to announce this later in the day at 1900 GMT, how will it bode for the people of the United Kingdom, for the children? Will the children and the people continue to remain safe? We've been joined by Dr. Anita Raja. She's a medical specialist from the United Kingdom. Anita, thank you very much to have joined us. Anita, first of all, did you get your vaccination?
Yes, I did. I did get my vaccination.
All right. Have you, which one did you have?
I had the Pfizer. I was part of the vaccination rollout program as well. So I'm a vaccinator myself as well, and I've had both doses.
All right, all right. So no side effects, nothing? Everything is fine?
It was absolutely fine. I just had a soreness in my arm. Apart from that, everything was absolutely beautiful. It was as if I had no vaccination done.
All right. Now, you've been dealing with a lot of patients as well, of COVID-19. What's the current situation as far as COVID-19 is concerned? And this decision by Boris Johnson that he's going to lift the ban as far as the reopening of educational institutions is concerned. How are the public in the United Kingdom taking it?
We have mixed reviews, of course, from the public. And we've got a segment that thinks that we should not be lifting this ban and, schools should not be reopened. However, on the other hand, we are dealing with lots of mental health issues. Families are burning out. Children want to get back into school. We've got a population of disabled children who need the attention. We've got children who are in need. They need to get back to school. So I think overall, we're sort of looking forward to schools being reopened so that there's some sort of normality for the kids.
All right. Now, Anita, also the first stage of the reopening has been divided into two parts. The first, of course, we've talked about from the 8th of March, the reopening of the schools. The second from the 29th of March, that is outdoor gatherings of either 6 people or 2 households is going to be allowed. It is, of course, a right step in the right direction, because as you said, a lot of people, are anxious staying at home since so many months. But do you feel going out in the UK is safe now?
I mean, going out, taking precautions might be definitely safe. But if you are thinking of going out and, mingling and not wearing your face masks, not maintaining that distance, then of course we're not just putting ourselves at risk, we're putting other people at risk as well.
Exactly.
It's a very tricky situation that we're stuck in, unfortunately, Omar. I don't think there is any right or wrong to this. People are anxious, people are scared. You do know that UK has been the hardest struck. We've lost 120 to 140,000 people so far. We've got this new strain to deal with as well. Our healthcare professionals are burning out, but we're hoping that this is going to be a positive step.
All right. Now, Anita, as far as this positivity is concerned, and of course going out, and I hope the people will take precautions, but there is, of course, a certain segment of the society, as in other parts of the country, as in Pakistan as well, that does not believe in COVID-19 or following the necessary precautions. What about those people if they are let out? I mean, I'm sorry to use the word let out, but I would just like your point of view on that. If they don't follow the SOPs, if one of them gets sick, what happens then? I mean, it could spread very quickly, won't it?
The NHS, the healthcare system here is under immense, tremendous pressure at the moment. A couple of weeks ago, London hospitals said that they were at breaking point. If people are going to be careless, they need to bear in mind that they're putting other people at risk. They're putting their lives at risk. If they're happy to take that risk, and if they're happy to, act carelessly despite all the danger that they're putting other people in, including themselves, then I think there's nothing more to say to that really, because I mean, we look at our numbers, look at the way we've been struck. I think that this speaks for itself. People are dying from COVID-19, and it's not a joke. And it's very sad that we still have a few people in the society who don't believe in it. But then, having said that, Umar, we have a very large BAME population of the ethnic minority groups who also don't believe in the vaccine. But that then comes down to lack of faith in the health system, lack of faith in the way things have been done in the past. And there's a lot to it, really. It's not as easy as people not believing in the vaccine and the virus. It's more about a lack of trust in the healthcare system, unfortunately, which has been bred in the past decades. It's not happened overnight.
All right. And finally, Anita, now the MPs I've heard and I've read as well will be given the chance to vote on the regulations enabling England's roadmap in the coming weeks. Now, will all depend on how the educational institutions open and how the parents and the children react to all of it, and whether there are more infections in the days or not? Is everything on standby depending on how this 8th of March decision will, and whenever it is, of course, applied, goes forward?
Umar, our Prime Minister has made it clear that he's going to stand with science and he's not going to budge and not come under any sort of pressure. I mean, he's been under so much speculation, under so much pressure. I think he's done well so far. He's trying his best. And yes, so the answer to your question is it's all going to depend on what happens once the schools are opened, how the cases go up or down, what the R number is going to be. And if, of course, we're able to get the cases down and the pressures of the NHS and hospitals, then yes, there is going to be light at the end of the tunnel.
I hope there is light at the end of the tunnel. I really wish and I hope for the people of the United Kingdom. And thank you so very much, Dr. Anita Raja, to have joined us online. We wish you all the very best, and also my regards to everybody around you and all the people around you. Thank you very much.